Onc Live Insights is a video editorial program produced by Onc Live.
The role of CINV in quality initiatives is very important, not only from a hospital perspective, but also from a reimbursement, i.e. Medicare-directed standpoint and initiative. It's really important when we talk about readmission rates. We know that CINV is one of the major reasons for readmissions to the hospital or infusion center post-chemotherapy. There are various guidelines now being placed and potential fee-for-performance guidelines that are being implemented throughout the country related to the quality of prevention of CINV. One of the major ways to reduce the readmission rate due to CINV is the utilization of standardized protocols. We know through various studies that those institutions that follow kind of national guidelines, whether it be ASCO or NCCN or MAS guidelines, the control of CINV is greatly improved versus those institutions that do not. This can also be helped with the utilization of EMRs or EHRs, depending upon what you want to call them. When you can put those guidelines in place on a standard pre-printed chemotherapy order sheet that looks at chemotherapy factors as well as patient-related factors, and then standardize the prevention of CINV, we know the outcomes are generally much better. In addition to EMRs or EHRs, as well as pre-printed standardized protocols for the prevention of CINV, the other area that can be utilized to really help readmission rates and the quality of the CINV prevention is the utilization of combination products. There are a number of combination products that are on the market and will be coming on the market that will target the various mechanisms and neurotransmitters for the various types of CINV, and also provides convenience for the patient that they can take one combination product and will cover them both in acute setting as well as delayed setting, instead of having to have multiple agents or take multiple agents. It's convenient, it's effective, and it really does help with the adherence rates to oral medication. So when we talk about the cost of prevention of CINV, we not only have to look at the direct costs of the medication themselves, but really factor in the efficacy of the agent. We know through various studies, pharmacoeconomic studies, that the total cost of care is greatly increased if you have a lot of breakthrough nausea and vomiting, if you have readmissions to hospitals, readmissions to infusion centers, where patients need to get fluid or additional antiemetics for the treatment of breakthrough nausea and vomiting. One of the best ways to reduce the cost of CINV, as I said, is prevent it in the first place, and that would include using the most appropriate, convenient therapies up front and therapies that you know the patients will take. When we talk about cost of medication, we need to make sure that we also look at the cost for the patient, not only just the cost of the hospital and total costs of treating readmissions and breakthrough, but also look at such things as their copay, as well as convenience for the patient. So we want to make sure that we use the most cost-effective agent for the patient in addition to being the most effective agent.